Hello and welcome. Today, we want to dive into a topic that we all experience but rarely talk about: feces. Yes, you heard that right. Let's take a look into the world of these ordinary waste materials that tell us a lot about the health of our body. During our diet, we go through an eating process that includes the nutrients we take in. However, this process produces waste and food residues that cannot be digested and need to be eliminated from the body. This waste material is called feces and is excreted through defecation. However, our stools are not always the same, and sometimes we may be concerned about the presence of health problems if possible abnormalities in our bowel movements appear. Different types of feces can tell us a lot about our digestion or state of health. In fact, stool classifications even exist to classify our stools and analyze the signs of possible diseases or problems. To give an example, a tool called the Bristol Stool Scale classifies stools into a total of 7 different types. This scale makes it easier for health professionals to identify stool types and helps identify potential problems. However, are you ready to take a deeper look into this topic? We're going to examine the types of feces according to the Bristol Stool Scale and discover what they can tell us about our state of health. So, before we start this exciting journey, please don't forget to subscribe to our channel and turn on notifications. Now let's take a journey into the mysterious world of feces. Types of feces according to the Bristol Stool Scale. One of the main scales used to assess stool is the Bristol Stool Scale, which divides the different types of stool into 7. This scale is very useful for doctors as it allows patients to identify the types of stool, often externally, and makes it easier to identify possible problems. The 7 main types of stool are as follows. Goat feces. These are stools in the form of small, hard, walnut-shaped pieces that are difficult to shake, resembling the feces of goats. These small pieces contain only water. This type of stool is usually seen in people with a strong constipation who have had food in the digestive tract for a long time. The subject usually has a lack of fiber in their diet. They can also cause obstructions of the digestive tract or megacolon. Earthy sausage consisting of ball-shaped structures. Usually this type of stool is usually healthier than the previous one. Constipated people are typical, though less serious than the previous one. The stools are in the form of a single elongated sausage, but large balls can be perceived as in the previous case. They have a hard consistency, which also indicates a lack of fiber in the diet. Although it is a clear sign of constipation, it usually has no serious meaning. Broken sausage. Although similar to type 2, in this case we observe a single structure, although it is possible to observe that they pass through different cracks and small protrusions. In this case, we are dealing with a stool with a soft consistency and one of those considered to be feces, indicative of the normative digestive process. Soft sausage. Taken together with type 3 as an ideal stool, this type of stool is characterized by having a unique and uniform shape. It has the shape of a sausage or blood sausage without cracks or protrusions and a soft consistency. It indicates normal digestion. Pieces of dough pulp with defined edges. This type of feces showed us a possible fiber deficit and a relatively fast passage without difficulty. These are pieces of fecal mass with well-defined edges and a pasty consistency. Pasty patches with irregular edges. This type of stool is characterized by being almost liquid, with only fragments with hard-to-recognize edges visible. It is usually produced during times of mild diarrhea, often preceded by indigestion or viral processes, and can cause dehydration. Completely liquid stools. This last type of stool corresponds to situations in which food passes very quickly through the digestive tract and occurs when acute diarrhea is of great importance. The stools are completely liquid, in the form of a puree, without any solid element visible. This type of stool occurs when there is a risk of dehydration. Color is also important. The above types are particularly important in determining what our stools are like, but there are other factors such as color. They can be indicative of different problems. In this sense, we should consider what the following colors mean. Brown stools. Brown is the general color of the stool, which is indicative of normal coloring. It can be light or dark depending on the diet. Green stool. Although it may seem striking, Usually the green color of the stools is derived from a diet enriched with vegetables containing chlorophyll or taking certain medications. They are common in the first week of life. It can also be indicative of food intolerances, blockages of the gallbladder, or rapid intestinal transit. Yellow stools. A yellow color in the stool can be indicative of more serious problems. It occurs as an effect of excess fat in the stool. You may be reporting liver problems, including hepatitis, gastric reflux, gallstones, some bacterial infections, or problems with celiac disease. Red stools. The red color in the stool can come from foods such as beets or tomatoes. However, it can also be due to the presence of blood in the stool, especially when spots appear in the stool or toilet water. This can be caused by injuries to the lower part of the digestive tract. Black or dark stools. The presence of black stools can be a danger indicator. It is usually due to the presence of bleeding or bleeding in the upper part of the digestive tract, which can occur as a result of cancer or ulcers, such as in the stomach, or due to excess iron. Also, the consumption of certain foods in large quantities can produce them. It requires consultation with a doctor. White stools. It is not usual, but it can also happen that the stools are white or white. This is abnormal and can be indicative of disabilities, bile deficiency, or liver or pancreatic problems. Also, ganglionic problems or certain tumors can produce them. Also, the consumption of certain medications can produce this coloration. If our stools are white, we should hurry to the doctor. When should you go to the doctor? Stool that is red, black, or clay, white is an alarm to call your doctor. And if you are worried about any other shade of poop, talking on the phone is not a bad idea. Experts recommend asking yourself these 3 questions before you alert yourself. Have you added anything new to your diet? Did you eat spinach or beets? Did you eat something with a lot of food coloring? Have you taken any new prescription, over-the-counter, or additional medications? Do you have any other physical symptoms? A major change in bowel habits, unintentional weight loss, localized pain, nausea, vomiting,